السلام علیکم ورحمت الله. سټوډنټانو پکې ډیمانډ کړی دی چې یو ویډیو پکې زموږ دپاره جوړه کا. نو که تاسو دا ویډیو ګورئ وای ګورئ څوک پکې پوه شئ، او که څوک یې نه ګوري نو خیر دی سکیپ کولی شئ. ډاون سنډروم باندې یو ویډیو کومه او دا د ماشومانو د ټولو نه عام مرض دی. ډاون سنډروم is the most common genetic chromosomal cause of mental retardation worldwide. There are three main causes of Down syndrome. Number one is meiotic non-disjunction. During meiosis, the chromosome does not separate and one of the gamete contain an extra chromosome of 21 pair and the other gamete is empty. When fertilization of that gamete occurs with the father chromosome, then the chromosomal count is 47 in spite of 46, and this is called meiotic non-disjunction, and that occurs in 94% of cases. And this is related to the increasing maternal age. Overall prevalence of Down syndrome is 1 in 650. At the age of 20 years, the chance of Down syndrome is 1 in 1600 roundabout. But at the age of 44, it is 1 in 37. So it is clear that with increasing maternal age, the chance of meiotic non-disjunction increases as well. The second cause is translocation. When a part of chromosome is translocated into another part, this is 14 to 14 or 15, 21 and 22 sometimes occur. If 21 translocation occurs, all the SIBs will be affected, 100% cases. This is only 4% cases, 5% cases that non-disjunction occur. If, for example, a young mother having a child, a baby of Down syndrome, then maternal and paternal chromosomal analysis is mandatory, karyotyping. In this condition, the mother is having translocation. If she is negative, then the father having. Another third cause is mosaicism. Mosaicism is 1%. Some of the cells contain 21 cells, chromosomes, and some contain 46, some 47. Means extra chromosome occurs in few cells only. This is called mosaicism, and it is 1%. Okay, now can we diagnose Down syndrome prenatally, intrauterine life? Yes. There are quad test. In quad test, you are doing AFP. AFP is down because it is down, and human chorionic gonadotropin, conjugated estradiol and inhibin are high. This is called quad test. And sonographically, ultrasound, knuckle lucency, we look for that there are fat pads over the neck, you can diagnose, and femoral length. So if you diagnose antenatally, you can terminate the baby. Now, coming to the clinical features, there are some features in Down syndrome, but not all the features present in all babies. There is flat occiput, frontal bossing, quadrocephaly, epicanthic folds, upslanting eyes, low-set ears, short neck, protruded tongue. Now, come to the heart. There are 40 to 50% cases having congenital heart disease, and the most common is AV canal defect. VSD, ASD, PDA, any other anomaly can occur. Then down to the intestine, there is duodenal atresia. Then come to the bone, sacral agenesis, and Hirschsprung disease is also very common. The hands are short and broad, and Sometimes there is simian crease. Yaqub and me are having single palmar crease, but it is not pathognomonic for Down syndrome. In a common people, single palmar crease can occur. You look at your hand as well. He is having one single palmar crease and I have two. I'm having, but in my right hand there are two palmar creases. This is also normally occur in general population, and there is clinodactyly, and between the big and the small toe there is sandal gap. So all these signs can occur in Down syndrome, but they are not pathognomonic of Down syndrome. Two things are very important, I will tell you. Mental retardation occur in 100% of cases of Down syndrome, and hypotonia. They are weak and low tone. Now, coming to the long-term complications of the Down syndrome, they are having recurrent sinopulmonary infections. They are prone to hypothyroidism. They are prone to leukemia. They are prone to celiac disease. They are prone to solid tumors, and they are prone to early Alzheimer's diseases. Two things I will clear to you, and keep this in mind, please. That male with Down syndrome is always sterile. They cannot bear, they cannot get married. If you get they get married, they cannot have a child because they are sterile, azoospermia. And female with Down syndrome, they are they can be conceived, they are able to conceive, but as they are mentally retarded, it is not recommended to marry them, and they cannot handle their menstruations. So early hysterectomy is recommended to a female girl with a Down syndrome. So if you are working as a doctor or as a pediatrician, you must know at least Down syndrome, because Down syndrome is the most common syndrome in pediatrics, and this is the most common chromosomal cause of mental retardation worldwide. Thank you for watching. Assalamu alaikum.